consistently. And this kind of a response by the community, by the legislature, sets a dangerous precedent sanctioning acts of discrimination, and is certainly not in the best interest of our state. Not only is it not reflective of our Iowa values, it's going to have vast economic costs in our state, as even the business groups in our state have figured it out and are protesting this kind of bill. You know, in North Carolina, they face serious economic consequences from a bill like this. They lost several rounds of the NCAA basketball tournament. That's the kind of thing that's at risk here. And we can't allow that to happen in our state. But just as importantly, if we want to attract young millennial creative talent to our state, we've got to stop this kind of activity right now. And if I'm governor, or when I'm governor, this kind of bill will never become law.
I would, as leader of the state of Iowa, I'd challenge the constitutionality in court, and I would sign on to that, and I'd have our AGs get on the amicus brief, friend of the court, to actually stand up against the attacks on folks in our state. And also, I think it's important to know that what would we tell the baker or the cake maker? That Iowa doesn't, this is not Iowa, this isn't who we are, and it's illegal to discriminate against anyone based on who they are, who they love, what they look like, or where they come from.
I would say to that business owner, we have to follow the law. This is not, I'm not a believer in President 45's belief of making America great again, looking backwards. My father was born in the South, and even as a child, I remember going down there and facing discrimination. I don't view this, refusing to selling to any person because of who you are. I just don't believe that. We have to look forward. We will do better together. Our communities will prosper if we are all rising. So I don't want to go back. Those aren't the good old days.
Well, if you believe in the concepts of individual liberty, but also, we all live here together, and do you believe in states' rights at all? Do you believe in federalism? And if you do, Iowa has, Iowa Civil Rights Code has sexual orientation built into employment, housing, public accommodation, education, credit. So to me, at the federal level, this gets dicey, but they always tell you, it seems like when there's a heated topic and people get passionate, they'll say, well, move if you don't like it. Well, here that is built into Iowa code. So I think you're going to have a hard time changing that, and I think that's a good thing.
Discrimination is discrimination. It doesn't matter who you are. As a woman, I've certainly had it. I'm sure Ross has had it. I'm sure we've all had it in different ways where you're discriminated against. It's a stinging rebuke. It's a feeling of not being valued. And we should never have this in Iowa. We're a welcoming state. At least we say that. And we should have a governor who stands up and says, this is not how Iowans are going to be. That we're going to treat every one of us. When I said at the beginning, I want every Iowan to be successful, this is what I'm talking about. We cannot have discrimination for any reason, for any group of people, or we're not making sure that every Iowan can be the success they can be. So I would absolutely stand up, and frankly, I like the fact we also use our marketability. I would tell people that we would always say that this is wrong and not have it, but take your business and go elsewhere if anybody even looked at you wrong.
People often ask me this hypothetical question. If I owned a bakery, my first question is always back to them, do you own a bakery? I've known one baker that this question might actually come up to. So people will throw that out there as a way to put you on the defensive. So while you may be able to discriminate against somebody, should you? No. And if I found out that anyone was discriminating, and what I would actually tell them is take a business class from me. I have been in business now, in some capacity for over 10 years. I've never discriminated against anyone, whether it be in hiring practices, whether it be with customers. If somebody is willing to pay you money, to do the service, why would you not take their money and perform the service? It's poor business skills for one, and secondly, you know, that's not very Iowa nice. I think the governor can use the bully pulpit, and so can a lot of us, and say that's not Iowa nice, and we can boycott businesses that do discriminate against people when we find them.
As governor, I'd oppose any laws that empower or enable someone to discriminate against someone else. It is not who we are. We're a community in this state. We've always felt that Iowa was a strong sense of community. That sends the wrong signal of who we are. It's bad for the state. More importantly, it's just wrong policy. To that baker, I'd say blowing out someone else's candle doesn't make yours shine any brighter.
As somebody whose parents experienced firsthand discrimination from stores and service providers, believe it or not, even in New York, because of their religion, absolutely I would not tolerate any law that codified the ability of a business person to discriminate on any of the grounds that are mentioned in the Iowa anti-discrimination law. It is absolutely impermissible. The rationale, we've settled this as a country a long time ago. We cannot permit stores to discriminate. It is not good for our morality, our conscience, or our business.
So our next question is a video question from Shay, who is a prevention specialist with the Project of Primary Healthcare.
African Americans and Latinos, specifically those in the LGBTQ+ community, ages 15 to 24, are disproportionately impacted by new HIV infections. Furthermore, post-diagnosis, they're less likely to stay in care compared to their white counterparts. As Governor, what spheres of influence would you engage in to ensure that these health disparities are decreased?
So no, that might have been a little hard to hear. So African American and Latinos, specifically those in the LGBTQ community ages 15 to 24, are disproportionately impacted by new HIV infections. So we see a lot of higher infections among our LGBTQ persons of color. Furthermore, post-diagnosis, they are less likely to stay in care compared to their white counterparts. So as Governor, what policies influence will you implement to reduce these health disparities? And we will start this question with Fred.
Thank you. When I served as chairman of the Planned Parenthood Board in the 1980s, it was during the height of the AIDS crisis. Proper education and access to quality care were extremely scarce. Stigma kept people from even getting testing and care. There's been a lot of progress made in education and the prevention of HIV since then, but there's still a lot of work to do. We need to address the stigma surrounding HIV. We need to support accessible and affordable prevention services like PrEP, but we also need to make sure that regular testing is available through facilities like Planned Parenthood. We need to ensure every Iowan with HIV gets the quality, expert treatment that they need through accessible, affordable treatment programs, and that includes supporting effective containment programs like safe needle exchanges. Overwhelming scientific evidence has shown the efficacy of needle exchanges in reducing the transmission of diseases. Even in states like Indiana and Utah have legalized and implemented safe needle exchanges. That's where we need to go. Thank you.
I hate to sound like a broken record, but if we had universal single-payer health care in this country, though, anybody that needed to get the services they need to keep them safe and healthy would be able to access their care without fear of discrimination or feeling like they don't belong. We absolutely need to make sure our healthcare providers throughout the entire system of healthcare in our state are well educated and understand cultural competence and gender affirming. They have to understand this and make sure that we are providing the top-notch quality care so that no one is afraid to go in and get tested, no one is afraid to get treated, and they don't have to worry about how they're going to pay for it at the end of the day.
Part of this is the single-payer plan. Another part is being willing to invest in organizations like Planned Parenthood and the Emma Goldman Clinic and others that provide healthcare, education, and treatment. Part of it is working with our public health department to do that education. Another part is being willing to, work with, in our school systems to do that cultural competency, but that cultural sensitivity, that cultural humility, to get our staffs, our workers being willing to understand and make sure that, again, we can't afford to have these disparities in terms of healthcare and treatment. It's opportunity, it's lost opportunity for all of our communities when anyone is not healthy, thriving.
All right, I think I heard a Democrat over there, Fred Hubbell, advocate for less government, so big up yourself, Fred. The needle exchange is a really positive thing, and I wholeheartedly support it. I'm working with my representatives, and they have both agreed with me, let's get this passed. It's a letting, people in your community basically voluntarily help people that need it, whether you get stuck by a needle accidentally or you get it in any possible way you can. Get tested right away. There's getting the bureaucracy out of healthcare actually would help, because as I understand it, if you're HIV negative, you can take a pill that's relatively, we could make it easier to get, that'll prevent you from getting carrying on the disease. So I think there's so many things we can do, and we can actually reduce the size of government while giving people better protections.
When I've talked to primary health care, we talk about they do a great job of non-judgmental treatment of the LGBTQ community, but we need more places that are able to do that. They need to be better educated on the LGBTQ needs. They need to be more culturally competent of what's appropriate and to understand their patients better. And I think that's something as a doctor, for all the medical profession, that's something we could lead on and get much better. And then they need to be gender affirming for what the patient needs. We have talked a little bit about PrEP, but it is something that is probably not well enough communicated to people, that there is a pill, a daily pill, that if you take it right, it's 92% effective. For a high-risk population or a population at risk, that's something that should be touted, and certainly at primary health care they are. We need to get that word out and educate people, but we have to have more places like primary health care that will take care of LGBTQ patients in the way they need to be taken care of.
A lot of the issues that we face are based around the stigma that we have surrounding them. We had a forum a few months ago, the mental health forum, that's also a stigma. Fred mentions that this is a stigma. That's something that we have to address. The governor can talk about this. All of us as individuals can talk about this. We can do more to educate people. That's certainly something that we can do. And it starts at the public schools, all the way up to the. Can you imagine the governor giving speeches on this instead of campaign rhetoric? I mean, wouldn't that be something? And I'm also excited to hear, Fred and Marco talk about the needle exchange programs. This is not a government needle exchange. This is nonprofits that are helping people out to address a real issue that people face. And it's something I've talked about for years, and I'm happy that it's finally coming up in the mainstream, and we've got potential legislation on these topics.
Create more awareness, and that comes from when you contract access to healthcare, you get an increase in problems, and so this is a product of that. This is a resource issue, making sure that there's public health clinics available, Planned Parenthood, other entities that enable folks to get healthcare that needed and get tested and needed. The needle exchange, I also agree with that. Good idea. It is. We saw an uptick in Iowa in 2016 in HIV cases in general, in addition to the higher percentage of the African American Latino population. So that's why you have a public health department. But unfortunately, we have a Republican legislature that's proposed getting rid of the public health department, which is exactly the opposite direction we should be going.
Hopefully that bill on getting rid of public health isn't moving anywhere. And probably the single most bizarre bill I've ever seen in the legislature, and I've followed the Iowa legislature for a long time. We need cultural competency and gender affirming folks, but particularly making sure that those things are written into contracts that the state has with various providers. Making sure that